Alrighty, so this talk is going to be on canine diabetics, and I am here with Cookie, and Cookie's dog Lacey has just been diagnosed with diabetes. So let's start at the beginning. Do you have anybody in your family that's a diabetic, or are you a doctor or a nurse?
I know nothing.
Okay, alright.
I just know it's scary.
Okay, good. I always start with that question because sometimes you launch into this speech and then they're like, oh yeah, I'm a pediatrician, I've been in practice for 30 years, and they already know everything you're going to say. Or they're a diabetic and they have been treating it for 30 years, so they also know everything you're going to say. Nice to know where you're starting. So, diabetes occurs when either the pancreas stops making insulin or the body stops responding to insulin. Insulin is a hormone and it is made in the pancreas, and what insulin does is it allows sugar to get out of the bloodstream and into the cells. It allows it to come across those cell barriers and get into the cells. So what we measure is blood sugar. But the reason the blood sugar is getting too high in a diabetic is because either the insulin isn't there or it's not working. It can't get out of the bloodstream and it can't get into the cells. So the signs that we see in a diabetic are because the cells are screaming for sugar. We can't measure sugar in the cells, we can only measure it in the bloodstream. So if it's too high in the bloodstream, then we know it's too low in the cells. And that's how diabetes works. There's two kinds of diabetes in humans. There's type 1 and type 2. Type 1 is usually the kid kind of diabetes, where the pancreas just completely shuts down and says, that's it, I'm not making insulin anymore ever again, and there is no insulin in the body. And those are the kids that get the pump and they do the insulin shots and they check the blood sugar. And once you give back the insulin, everything is fine, but they're on it forever. Type 2 diabetes is kind of what we call old man diabetes. It's for a pancreas that has done all it can do. It's still making insulin, but the body is not able to respond to it anymore because of a lifetime of too high carbs, too much sugar. The body just doesn't respond to insulin the way it used to. So there's still some insulin there, it just can't work effectively anymore. And sometimes they can be controlled with just diet, lowering the need for insulin by lowering the carbohydrates. Sometimes they need some insulin as well. Dogs are pretty much always type 1 diabetics. Even though it does happen as they get older, they do still respond to insulin, they're just not making the insulin the way they need to anymore. So, when we have a dog that we're diagnosed with a high blood sugar, we know they're going to need to be on insulin. And here's what's great about dog diabetics. There's a lot of great things about them. The first great thing is they're very resistant to the effects of high blood sugar. When people go diabetic, they worry about, am I going to start to lose toes? Am I going to start to have non-healing wounds? Am I going to have, the horrible sores and the things that you sometimes see in human diabetics? Dogs just don't do that. The only really bad thing that can happen with a dog diabetic, and it happens almost every time, is they will get cataracts. In time, they will get cataracts. Now, the changes that cause that to happen, those changes have already happened. By the time we realize that a dog is diabetic and we see these high blood sugar, it is already too late. Those changes have happened. At some point, we're going to start to get some cataract, so the lens is going to start to get real opaque. So what I always tell everybody is start thinking about that now, because in 6 months, a year, 2 years, depends on the dog, probably she's not going to be able to see anymore from these cataracts. Start saving money right now because they can be fixed. There is a surgery. It is super effective. It works great. Their vision comes back, but it is quite expensive. It's a couple $1,000s. So think about if you want to start saving for that now so that if it does happen, you can afford to have that surgery done and then they can see again. It doesn't happen again because you take out the old lens and put in a new one. So that's just something to think about for the future.
That's great.
So here's another thing that's great about dog diabetics. If I went diabetic today, here's what I would be thinking about with myself. Last night I went out to dinner and we went down to a restaurant and we had a big meal. And this morning I had cereal for breakfast and I'll probably go home for lunch, and tonight we're going out with our parents. I eat something different every single day. I eat something different every single meal. I did nothing yesterday, and tomorrow I'm going to go on a 30-mile bike ride. So my activity is different every day and my food is different every day. So that's why when you see human diabetics type 1 or type 2, they have to check their sugar, because things are different for a human every single day. The awesome thing about dogs is they eat what we feed them and they do what we do with them. So once we figure out how much insulin we need for this dog and this food and this basic activity level, then we pretty much have it. So that's why you don't have to be doing blood sugar checks at home. I will be doing the checks here every now and then, but once we have it, unless there's a change, we pretty much have it. So that makes them so much easier to deal with than a human diabetic. You don't have to be doing any kind of blood sugar checks at home. If you want to check something at home, I can write out a script for you to get some urine test strips from the human pharmacy, and you can check the urine sugar at home just to kind of keep an eye on where things are going. But what you're going to notice at home is all this drinking and peeing you've seen, this is going to go away. And as the drinking starts to come back down to normal, that tells us that we're starting to get the diabetes under control. So how are we going to treat this? What kind of food is she eating at this point? What have you got her on right now?
Adult Purina.
Okay, good. Adult Purina is absolutely fine. There's nothing wrong with that. My big thing is I don't really like to change the diet. Everything has changed metabolically for her lately. I don't like to change foods right now because whatever food she's eating, as long as it's a decent quality food and not home cooking, any kind of decent food is pretty much fine. We're going to stick with it because I want her to keep eating. The key is consistency. The more consistent we can be. So whatever food you're feeding, the Purina is absolutely fine. And whatever treats you give, let's just try to keep it as consistent as we can day to day. Because once we figure out how much insulin we need for that, we're going to have it. Okay. So I don't want you to change the diet. Do you free choice feed or do you meal feed?
Free choice.
Okay, and that is also fine. You can certainly keep doing that. And I like that because if her blood sugar ever starts to dip down and gets a little bit low, she can eat something and raise her blood sugar up. So that is very helpful. I'm totally fine with that. One thing I will suggest is let's find something that she really likes, some kind of a treat that she likes, because we're going to be starting our insulin shots. And I don't want her to run away from you when it's insulin shot time. I want her to run toward you and say, it's time for my shot, because that's when I get a wonderful treat. And they absolutely will do that. The shots are very, very easy. The needle is really, really tiny. They don't even notice it going in. So I want her to be coming to you, dancing around at 6 o'clock, saying, hey, it's time for my shot and my wonderful treat, whatever the treat is. Doesn't matter. Just keep it consistent. So what are we going to do? We're going to do insulin shots. Insulin shots go as close to every 12 hours as you can. You do not need to reorganize your life to make this happen. As close to every 12 hours as you can, definitely 2 shots a day, never within 8 hours of each other. So think about your timing, think about your schedule, and let's say right now, just as we're talking, you're going to do 6 a.m. and 6 p.m. That's going to be your time. It doesn't matter. Whatever works for your family is cool, but for today, we're going to say 6 and 6. So you give your 6 a.m. shot this morning, and then you go to work, and tonight, though, you're not coming straight home from work. You're going to go out to dinner with your friends. That's fine. Go out to dinner with your friends. If you don't get home until 8:30, that's fine. Give your shot at 8:30. No problem. As close to every 12 hours, not within 8 hours. So now it's the weekend, and we get up at 6 and we give our 6 a.m. shot, but you're going out straight after work, and you're going to be partying until midnight, and you're not going to be home until midnight. Okay, that's okay. You can give your shot at midnight, but don't give your next morning shot at 6 a.m. You need to push that back a little bit. So 8 a.m. or 9 a.m., you can fudge them a little bit forward, you can fudge them a little bit back. As close to every 12 hours, never within 8 hours. Does that make sense?
Totally.
So
totally makes sense.
You do not have to change your whole life around this. You just do the very best you can.
Gosh, that's great.
So yeah, it's much easier than people think it's going to be.
Yes, absolutely.
The next thing to tell you is the amounts of insulin. And so here's how it works. So we talked about how the insulin lets the sugar come out of the bloodstream and into the cells. So as we give the insulin, as the insulin starts to work, the blood sugar is going to lower down. That makes sense, yes?
Yes.
Okay. We've had high blood sugar. Her blood sugar was 465 when we checked it this morning. It's very high right now. Normal is 80 to 120. We're not shooting for that tight a control, but I want it to be in the 100s. I want it to drop down much, much closer to normal than it is. But here's the great thing. It's 465 today. It's probably been 465 for a month. And she's doing pretty well. She's drinking a lot. She's peeing a lot, but she's still eating. She's still happy. She still looks pretty good. So what that tells us is high blood sugar, they're not super healthy, but they're okay. So low blood sugar, not the same story at all. If we give too much insulin, or if we don't have blood sugar for the insulin to work on, now the blood sugar is going to drop too low. That is very dangerous. If we get below 20, that's when we start to see low blood sugar signs. So what are low blood sugar signs? Sometimes they'll get real stiff, or sometimes they'll get really limp. They'll get kind of twitchy. They'll get kind of shaky. They'll kind of sometimes sort of lay down and just get really, really, really woozy and wobbly. If it gets really bad, they'll actually have a seizure. Now, that's not going to happen to you because we're going to be really, really careful with this, and we're not going to let that happen. But if anything crazy happens, and that should happen, what I want you to have at home is Karo white corn syrup, that you just buy at the grocery.
Yep.
You're just going to take a big fingerful of that. You're going to wipe it right in her mouth. She doesn't even have to swallow it. Just wipe it all over the inside of her mouth, and then come on in and see me. And if it's the middle of the night, go to the emergency clinic, and I'll make sure you know where those are. Low blood sugar is an emergency, so get some corn syrup in there and then get her to a vet that can get her on an IV and get some sugar in. But it's not going to happen to you. So what that means is skipping a dose of insulin. What will that mean? That'll mean the blood sugar will go too high. Doubling a dose of insulin by accident. What will that mean? Blood sugar too low. So one of those is dangerous and one of those is not. So what does that mean? That means if you're not sure, if you go to give your shot and you're working with a needle and she jumps when you give it and you go, oh my gosh, I don't know, did it go in? Did I just squirt it on her? I don't know. Do not give it again. Assume you gave it. If you didn't really get it in, that's okay, no big deal. Okay, we skipped a shot, who cares? Doubling a dose can leave you with no dog very, very quickly. Skipping a dose, she'll be thirsty, she'll drink a lot. No big deal. Same thing goes for if you get up in the morning and Jim's already gone to work and you go, I don't know, did he give the shot? He's not answering his phone. I don't know if he gave the shot this morning or not. Do not give the shot. If you skip a dose, no big deal. The sky doesn't fall. If you accidentally double a dose, yes, the sky could fall because the blood sugar could get very, very, very low and you might not be home to see it. That makes sense?
Totally.
If in doubt, skip it. Any doubt, skip it. So we're going to start you with the insulin, and I'm going to write you a prescription. Insulin is a human drug, and you're going to go to the human pharmacy. We're going to start with Humulin NPH insulin, and it's a fantastic insulin. I have never had a dog that I couldn't control on this kind of insulin, and here's the great thing about it. Walmart has their own house brand of NPH insulin, and it's about $30 a bottle. Anywhere else you go, the exact same kind of insulin is going to be like $85 a bottle. So even if you don't go to Walmart for anything else, it's absolutely worth it to take this written prescription that I'm going to give you. Go to Walmart and have them fill it because it's less than half of what you're going to spend. So you're going to do that tonight. You're going to go ahead and start it tonight, and we're going to check back in a week or so, and we're going to see how we're doing. I'm going to start her on insulin that I know is going to be too low. I know it's going to be too low. We're going to come back in a week. We're going to check her blood sugar. I know it's still going to be too high. But I need to see how high because that's going to tell me how fast I can creep up to where I think we should be. So always better to err on the side of less insulin rather than more, right?
Right.
Okay, so we're going to start low. This week she's still probably going to be drinking a lot and peeing a lot, but then we're just going to slowly inch it up. So when do I want to see her? Humulin NPH, the high point of its action, which means the lowest blood sugar, usually happens about 4 hours after you give it. So if you're going 6 a.m. shots, so 7, 8, 9, 10 a.m. is the magic time for me. I don't care what the blood sugar is any other time of the day. I care about 10 a.m. approximately because that's going to be the lowest blood sugar of the whole day because that's 4 hours after we gave the insulin. That's when it's working at its maximum. That's the lowest point. That's what I care about because I don't want to accidentally dip too low. So when I'm going to see her from now on is going to be 4 hours after your morning insulin dose, whatever time that ends up being. That's what I care about. So I want to see her in a week or so after you get under control and after you're doing these shots at home. You're going to come in, we're going to check her 4 hours in, and we're going to see where we are. It'll still be too high. We'll up the insulin a little bit. I'll have you come back in a week or two. We'll check it again, and we're going to keep doing that until we get to the point, and you're going to notice this at home. You're going to go, wow, she's suddenly starting to drink normally, and she's not peeing a river of pee anymore, and she looks good, and she looks happy. That's when we're getting real close. And again, I'll check at that 4 hour. Probably that's going to be when we're in the high 100s, low 200s, and that's pretty much what we're shooting for. Once we get that, and that may take us 2 weeks, and that may take us 8 weeks. It just depends on the dog and how we do with all that. Once we have it, then we have it. Then I'm going to send you away for a month, and you're going to keep doing your thing at home. We'll check again in a month, and if we're still where we need to be, if everything's good, nothing's changed, then I'll send you away for 3 months. I'll check every 3 months, pretty much forever. The only time the insulin's going to change is if something changes in her. So if she should get sick, if she should get some kind of infection, if something changes in her body, yeah, we might need to change her insulin. But otherwise, once we figure out this insulin for this dog, this food, this activity, if everything stays the same, you're just going to keep doing whatever you're going to end up with her. She's a little one, so probably 5 to 6 units of insulin is where we're going to end up, and that's what you're going to give her. So you will get your syringes also from Walmart when you get your insulin. Have the pharmacist show you on the syringes they give you where 2 units is. We're starting with 2 units. And I'm going to show you on my syringes when I teach you how to give the shots. I'll show you where 2 units is on mine, but they're all different. Some of them align as 1 unit and some of them align as 2 units. So have the pharmacist there show you on your syringes where 2 units is. And then bring one when you come for your visits so that as I tell you how we're going to creep up, I can show you where that is each time to make sure we're giving the right amount of insulin. Save your insulin syringes. Just keep them in a coffee can or keep them in a shoebox or something like that, and bring them to me, and I will dispose of them for you. You can't just throw used needles away in the garbage can. You have to have the special sharps thing. So bring them to me, and I'll get rid of them for you. You just drop them off anytime, and that's a service that we provide. So we're going to write you your prescription, and then we're going to teach you how to do the shots. And the nurses will teach you how to do the shots. They'll teach you how to draw it up. But here are my tips for insulin. Insulin lives in the refrigerator. And you don't want to shake your bottle really, really hard because you'll kill the insulin molecule, and then your bottle's no good anymore. So when you get your insulin out, it'll have kind of settled down. You want to just roll it between your hands to mix it up. So you just want to just gently mix it up, and you'll be able to see when it's settled down, and when it's mixed up, it looks like milk when it's all mixed up nice. So here's my advice. We're going to open the refrigerator. We're going to stand in the open refrigerator. We're going to have our syringe. We're going to pull up our insulin, and we're going to set it back in, and then we're going to close the refrigerator door. Because if you don't, here's what's going to happen to you someday. You're going to get it out, and you're going to go over to the counter, and you're going to be pulling up your insulin, and the phone's going to ring, and you set it down, and you walk over, and you get the phone, and then the kids are crying, and then someone's at the door, and then you go off to work, and you get home, and your insulin has been sitting out all day, and it's warm, and now you have to buy a new bottle of insulin. If you always just pull it up standing in your open refrigerator, it never leaves the refrigerator, and that will never happen to you. It can be out for an hour. It's not a big deal. But if you bring it out and set it down, someday you're going to forget it, and then you got to buy a new bottle. So a bottle of insulin will last you longer than they say. The pharmacist will say, oh, you have to throw it away in a month and get a new bottle. No, you really don't. You can pretty much use it till it's gone. If we feel it's losing its effect, yeah, I'll have you get a new bottle. But a bottle of insulin will last you several months. So basically at this point, what you're going to be paying for is, we'll pay for the blood sugars when you come to see me, which will be every couple of weeks until we get it sorted. You pay for your insulin, and that's really the expense that is involved in this. It's not a horribly expensive disease. And the great thing about diabetics is she is going to live as long as she was going to live anyway. This isn't going to shorten her life as long as we get her under control and do what we're supposed to do. She's going to do fantastic with this. So the big things to remember: 2 shots a day, as close to every 12 hours as you can, never within 8 hours of each other, and keep everything as much the same as you possibly can. Does all of that make sense?
It makes total sense.
Okay. Any questions that you have for me? Anything I didn't tell you?
I don't have any questions. And this, it was great. I learned so much with this.
Awesome. Excellent. Well, then here's what we're going to do. I'm going to go write you your prescription, and I'm going to get you the syringes, and we're going to teach you how to do it today. The nurses will show you how to actually give the shots. And if you need another lesson, if you get home and you go, oh my God, I don't know what I'm doing, come back in. We'll give you another lesson. We're going to teach you until you're comfortable, because you'll be doing this at home tonight, and I'm not going to be there. So we're going to teach you until you're comfortable doing this. And in a week, it's going to be like you've done this every day for your whole life. It's going to be the easiest thing in the world. And I'll see you in a week at that magical 4-hour mark after your morning insulin. And if you have any questions or concerns in the meantime, if anything seems weird, you call me. I'll be here.
All right, sounds good.
Okay.
Thank you, Dr. Wendy.
You're very welcome. And that is the Dog Diabetes Lecture.